Hello, my name is Richard Dickson. My wife and I have been associated with our house and cancer care of North Central Washington from the very onset. I had the pleasure of knowing Betsy Tontini before she had the idea of starting our house. Period. Betsy was a lady of many ideas. She was a nurse on the oncology unit at the what is now Confluence Health, then called the clinic. I was in the Department of Neurology, and it soon became apparent that everyone in the clinic knew Betsy. She was inspiration for a number of things. Betsy realized that the nurses dealing with all the patients on oncology were under considerable stress, as many of the patients were quite sick and dying. She arranged for group sessions with the local psychiatrist, Dr. Robert Permit, to help the nurses through some of these stressful times. She and her sister, Margie Kerr, also had the inspiration for Make a Difference Day, which occurs every October and has taken on quite a life of its own. But Betsy realized in her work at the Department of Oncology that there were many patients who came from a distance all over North Central Washington, from Tonasket to Moses Lake, who had the requirements of radiation that would often be a daily radiation therapy, and it was very difficult for them to come from those distances on a daily basis. It was her idea to set up some sort of home for patients to stay while they were undergoing their radiation, and that was the inspiration for our house. Our house was originally a home that was purchased with generous donations on Fernie Street at the corner of Fernie and Madison. This was originally a 3-bedroom home that was able to manage 3 patients and their families if there was some. And Betsy had a number of volunteers to help get this house organized. It wasn't long before Betsy was able to talk her husband, Nevio, into adding 2 more bedrooms to this home to provide it with 5 bedrooms. The expansion onto Castle Rock with the new home in 2000 was again brought about by the hard work of Betsy Tontini, and not to mention her husband, Nevio. If Betsy was the inspiration, Nevio was the nuts and bolts of many of the operations. In 2000, the current Our House was built, mainly with volunteer laborers under the direction of Nevio, and the house is really quite amazing. It now has the capacity to manage 8 patients with who are there on a daily basis from Monday through Friday. Period. This is home is managed by a daily manager, Becky Allwood, who has been there for the 20 years that it's been going on now, and does an amazing job organizing patients arriving, setting them up, and managing their discharge. Without her, it would be an operation that would have much more difficulty managing. There are a number of volunteers that are at Our House on a daily basis and help with managing the patients that are there for their therapy. The organization of North Central Washington Cancer Care has been the benefactor of a very large number of donors, so that we've been able to accumulate a fairly good war chest. From this war chest, we managed to maintain the house, pay out for all the utilities and updates that go on there. In addition, there has been the ability to establish a social service fund. The social service fund has a budget of about $20,000 a year, and that budget is used, the monies of that budget are used to distribute funds to patients suffering from cancer that need a little help. This might mean enough money to pay for gas for a trip to Seattle for other medical care, or cards from Safeway to buy groceries for patients that are in need. Also, through the foundation, monies that Cancer Care has accrued, we're able to provide nursing scholarships. My wife, Danny, has been instrumental in this, and every year approximately $20,000 is distributed to those students applying to the nursing college at Wenatchee Valley College, and receive scholarships anywhere from $1,500 to $2,500. The one of the major things that is important in regard to our house is the volunteers, both at a day-to-day level and those on the board that give their time and energy to maintaining this very good and organization that is really one of the standouts in the valley here. I'm proud to be a part of this organization. I've been on the board for a number of years, and I will continue to be supportive. That's my take on our house and Cancer Care in North Central Washington.